know that you can have options regardless of your age, and to really empower women with this idea of being proactive. And I think the reason why it's so important is if you think about any other aspects of our medical health and our health in general, we're all about being proactive, right? We eat well, we exercise, we go to the dentist, we go to the eye doctor, we go for our regular checkups in an effort to prevent disease, right? We don't want to be overweight because we don't want to get diabetes, high blood pressure, heart attacks. And so on the same token, I want women to be proactive about our fertility, because unfortunately our current kind of state of affairs is we wait for women to have a problem before they address the issue. And so what I want to alter and change is that we as women can say, okay, I want to learn as much about my egg count, I want to learn as much about my body now so that I can make the right choices for me in the future, as opposed to waiting till you have a problem and then recognizing, oh gosh, I wish I'd known this 10 years ago, I would have done things differently. So it's really all about being proactive, and because the more proactive you are, more likely the more options you will have. So when are we most fertile? Let's kind of go back to some basics, right? I just mentioned to you at the beginning of this that most of us spend our entire lives desperately trying to not get pregnant. So I think it's good to just kind of go back to some basics. So if a woman has regular cycles, and I stress that, and by regular cycles, I mean that you get your period, every 28 days or every 30 days, that you have a predictable cycle. So in a woman with a regular predictable cycle, the most fertile days are day 10 through 14 of that cycle, where day 1 represents the first day of your period. So if day 1 is the first day of your period, your most fertile days are days 10 through 14. And so in women who are trying to conceive, they would, try to have sex mostly in that window up to a few days prior to that 10th day and up to that 14th day. And the reason for that is that there's only about 5 days each month. I know it's crazy to believe, but there's only about 5 days each month, 72 hours, that we're actually fertile each month. And so that's why, a lot of times when women come and see me and they're like, well, my partner and I have been trying for a few months to get pregnant and it hasn't happened yet. If you really step back and say, okay, I'm only fertile 5 days a month, there's then an additional 25 days of that month that you're not fertile. And so it's really important to understand that. And that becomes helpful for women whether you were trying to get pregnant or whether you're trying to avoid pregnancy. Because I think either way, the more we understand about our bodies, the more kind of in charge we can be. And so that's how that part works. And then the other part to understand is that sperm stays in your system for up to 72 hours. So if you had sex on the 7th day of your cycle, you could still get pregnant because that sperm could still be in your system 3 days later. And when you're on birth control, this is kind of a good note to have, because women will often come and say, oh, I've been on birth control for 10, 20 years. Does that mean I'm more fertile because I didn't lose eggs? And the key is we still lose eggs when we're on birth control. The only thing birth control prevents is it prevents one egg from maturing or ovulating. And I'm going to touch on ovulation in just a second. All right, so how does ovulation work? Ovulation is a process by which our body matures one egg each month, and that one fully mature egg is the egg that has the full potential of becoming a baby. We still lose up to 1,000 eggs each month. It's just one egg reaches that opportunity of becoming a baby. So I have a cool tissue box analogy that I'd like to show you guys. So imagine this tissue box represents your ovaries, your right ovary and your left ovary, and within both your ovaries are all the eggs that you have left today, April 20th, 2020. Because remember, as women, we're born with all the eggs we'll ever have. And so the eggs that are within our ovaries are microscopic. We can't see them. We can't count them per se because they're all microscopic. But we can get an idea of how full your tissue box is or how full your ovaries are with eggs with a hormone test called anti-Müllerian hormone, or AMH. And this is a blood test that can be done at any time during a woman's cycle. And then what occurs is each month your body recruits a set of eggs from your ovaries. And this set of eggs are now grown and have entered this maturity phase. And these eggs we can actually see on ultrasound. So when someone comes in and we do a follicle count, we're actually counting the eggs your body recruited in that given month. Okay? And then our brain sends a signal to this batch to help one of these eggs fully mature, okay? So a group of eggs were recruited for the month of April, and then my brain sends a signal to this batch to help one egg fully mature. This one fully mature egg is the only egg that has the capability or the potential to become a baby, okay? And so at the end of the month, let's say you are not having sex or you're using protection, this one mature egg is lost, as well as the entire batch of eggs that were recruited for that month. And then your body goes back to the drawing board, and for the month of May, recruits another set of eggs, and this cycle continues, okay? And so the best thing to understand is that the number of mature eggs that we have each month is just one, but we can lose up to 1,000 eggs per month. And so that's ovulation. Ovulation is just the mechanism by which our body matures that one egg. So what are things that are really important for us to understand when we talk about fertility? And this is Fertility Awareness Week, and one of the things that we're really passionate about at Kindbody is being accessible and educating women about your fertility. So really important, you can't talk about fertility and just focus on your uterus and ovaries and vagina. It's particularly important to think about diet, lifestyle, mental health, family history, our nutrition. And so that's why we're so proud to be offering a variety of things this month that really highlight, this week that really highlight the diet and exercise and mental health that we think are so vitally important. And so if you go to our Instagram site, we actually have really neat events from yoga and meditation and support that are available throughout this week, just to really stress that fertility is not just about your eggs and ovaries and about your entire being. And we really do feel passionately about that at Kindbody. So when we talk about diet and lifestyle, where the most important things to understand, and we'll go over them in a moment, is how important it is to have a balance, and really strongly feel that everything in moderation is so important. So I'm not saying that it's not a good thing to occasionally have your junk food and treat yourself to that vanilla ice cream or whatever it is that is your treat of choice, but to recognize that that there's always a balance. Mental health is obviously so important, because whether you want to be pregnant now or 10 years from now, taking care of our mind, body, and soul is so vitally important. And then family history becomes particularly important for women, because we have to think about, it's not so much, for example, sometimes women will come to me and say, oh, my mom had me when she was 42, so I'm going to be fine, and I don't have anything to worry about. And it could be, but it may not be. So just because your mom didn't have a problem having you doesn't necessarily mean you'll follow that same suit. And it's really important for women to know how old their mom was when she stopped getting her period. So how old was your mom when she went through full menopause? Because women whose mothers went through menopause younger than the age of 45 are more likely to have early menopause as well. And if you're at risk for early menopause, it means that your egg count could decline more quickly. One final note is that being on birth control doesn't harm or benefit your fertility. So for example, you may have been on birth control since you were 15 years old, and you've been on it now for 10, 20 years, and you come off and you find out that your fertility is low. Your fertility isn't low as a result of the time you were on birth control. Your fertility is low as a result of your age. And so that's a really important thing to understand, that having been on birth control doesn't benefit us, but it also doesn't harm us. So at the end of the day, the most important thing to understand is that there's no magic formula. There isn't any one particular thing that's going to make you fertile. There isn't one particular thing that's going to make you infertile. Really, the most important thing to understand is that we need to learn about your own objective truths. We need to learn about your body, review your personal medical history, review your diet, review your lifestyle, review your mental health. Go over all of these things together step by step. Do those ultrasounds, do the blood work, and really find out objectively for each and individual woman what is going on with your body, and then put it together and say, okay, what is it that I want, right? Because a woman who is trying to be pregnant today or wishes they were pregnant yesterday is a whole different can of worms, or a whole different cascade of options that she needs to explore than a woman who's interested in having children in 10 years. And so it's really important to be honest with ourselves and say, you know, where am I at in my life? What is it that I want? When do I think I want those things? So that we can then help tailor the solutions specifically for you. So what can you do? We can start off with a virtual consultation. Listen, we live in a whole different state of normal. We understand that one, many of you are in cities that are still in lockdown, and we know that social distancing is so important for all of us for our health right now. And so we are offering virtual consultations. And what that is it's a one-on-one consultation with a physician or fertility specialist. We discuss your medical history. We go over your family history. We talk about any medications that you're on. And we talk about what you want. What are your plans? Are you trying to have a baby now, or would you like to potentially have a child in 10 years? Are you thinking about a small family or a big family? And so we can then personalize a plan for you and say, okay, based on your goals, based on the timing of your goals, this is what we need to do to learn more. So it's really nice because, one, it allows you kind of get a nice overview of what you personally need, and then we'll tailor a step-by-step next steps for you so that you know, okay, I need blood work, I need an ultrasound, and this is the timing that's best for it to be done. So the virtual consultations are really important, and I encourage all of you, you know, to take 30 minutes out of your day and learn more about your body through these virtual consultations. And we'll send you guys a code and instructions on how to schedule those at the end of this 101 event. And then what we follow up once you've had your virtual consultation, when you're ready and feel comfortable, and again, we know everyone has their own level of comfort at these days, but let's say you're ready now, you could come in literally in New York today, and in California and Santa Monica as well. Or maybe you're not quite ready and you'd like to wait, you know, a few more weeks before you're ready to come in. But whenever you are ready, we would then have you come to our clinics where we do blood work and ultrasound. The blood work is checking that hormone called anti-Müllerian hormone. Remember when I used my tissue box analogy, I said these are both your ovaries, and since all the eggs within our ovaries are microscopic, the same way as you can't tell how many tissues are in this box, the AMH hormone can give us an idea of how full your tissue box is or how many eggs are in your ovaries. And it's a hormone level that can be checked at any time during a woman's cycle. And it can be done whether you're on birth control, you have an IUD, or regardless of when your period was, or if you haven't had a period in years, or you get your period every month. But it's a really nice, simple blood test that we do in the office. And we combine that with the ultrasound, and the ultrasound allows us to structurally look at your uterus, look at your ovaries, look for cysts, fibroids, masses, but then distinctly we actually count the follicles within the ovaries. And the best way to think of follicles are premature eggs that your body recruits each month. And so we can find out with the combination of the ultrasound and the hormone test specifically how many eggs you have, how fertile you are, what your ovarian reserve is, and then combine that with the information we gained in your virtual assessment. We can say, okay, based on your goals, these are your options, and this is what's going to either help you preserve your fertility through egg freezing, or here's some information for you as a couple who's planning on starting to try this summer, so you know before you start that everything is fine. Or let's say you're a couple who has already had experienced some miscarriages, or you're a couple who has been embarking on trying to get pregnant over the last 6 months to a year. We can tell you, okay, from an egg count perspective, from a fertility perspective, where you're at, so that then you can make the appropriate next steps. And what do we learn from the ultrasound and from the blood work? You know, I just mentioned it to you, but one of the cool things about Kindbody is that we really love to utilize technology, and so you'll get results over the phone with your doctor or in person, depending on how you prefer to do it. But we also send you results to your own Kindbody portal that are easy to understand. And we really pride ourselves on that, because I know, not just as a doctor, but as a patient, how intimidating it can be to get results from a doctor and you're like, I have no idea what any of this means. And so we really like to break it down for you so that when we give you your results of your egg count and your hormone levels, we actually explain what they mean, and you can access to them from the comfort of your phone or computer, so you can share them with your loved ones or your partner. And the most important thing to understand is that we're here to help you through that journey. So it's not just a matter of, okay, here's your results, you know, bye, but it's here's your results, and then let us help you navigate the next steps. All right, so you have options. So let's say you're a woman who wants to delay pregnancy for as long as possible, or you're a woman who wants to have lots of children, maybe 2 or 3 or more children, and you want to make sure that you can have your last kid. We can talk about egg freezing. Let's say you're a couple who wants to either improve the chances of having 2 or 3 kids in the future, or you're just not ready to have kids now and you want to freeze embryos. We can do that. Or let's say you've been having some difficulty getting pregnant. Depending on your individual case, we'll talk to you about intrauterine insemination or in vitro fertilization. For couples who are trying to get pregnant, I think the most important take home briefly in this session is just to understand that IVF is not always the answer, and that there can be less invasive ways to help a couple conceive. And sometimes it's as simple as monitoring your cycle and telling you exactly what days you're fertile, and telling you, hey, you know, the best time for you to have sex is during these couple of days. And some people just knowing when to have sex can help them achieve a pregnancy. And we're really passionate about getting you pregnant as non-invasively as possible. So if IVF is not the best choice for you and it's too invasive, we'll work with you and tell you kind of here's the easiest way for you to conceive based on your age, based on your hormone levels, based on your ultrasound. So we're not just going to push a couple to do IVF unless they actually need it. And so those are things that we'll walk you through. And it is the most important factor to understand that it's all very individualized. So what's egg freezing? Think of egg freezing as an opportunity to press pause. It's being opportunistic. So if we go back to my analogy that I showed you, remember that each month our body recruits a set of eggs, and at the end of the month, all of these eggs are going to be lost, up to 1,000 of them. So what we do with egg freezing is we say, okay, I know that our body recruits a set of eggs each month, and I know that my brain sends a signal to help one egg fully mature, and I know that only fully mature eggs have the ability to become a baby. So egg freezing, we say, okay, so we know we have to have fully mature eggs, and we know we have a whole set of eggs that get recruited each month. So what we do is we give you the exact same hormone that your brain releases, but we give it to you at a higher dose to help this entire batch fully mature together, or as many of them as possible. And then once they reach full maturity, we extract them and save them for you to use in the future. So what we're doing is just being optimistic. We're not stealing from your fertility. So as a matter of fact, a woman could freeze her eggs, let's say in May, and then try to conceive naturally in June. And by freezing your eggs, you're not making it more difficult for you to get pregnant. All you're doing is saying, I know these eggs are going to be lost at the end of the month anyway, so let's be opportunistic. Let's help them mature, which is why the injections are necessary in egg freezing. And then once they're mature, let's extract them and save them for you to use in the future. And so it really is like pressing pause. And once these eggs are extracted from your body, they will remain that same quality as the day they were frozen. So if you freeze 30-year-old eggs, these eggs will be 30 even if you're actually now 40. And that's the most important thing to realize. It truly is like pressing pause. And so what should you consider if you're thinking about egg freezing? These are kind of homework assignments that I always give women. So before you schedule your virtual consultation, I encourage you to ask these questions to yourself. Number one is, how old are you? And be honest. Number two is, how many kids are in your ideal family? And again, it's so important for us women to be honest with ourselves. You know, do you just want one baby? Maybe you're not even sure if you want one. Or are you the woman who really aspires to have a big family because you are from a big family? Or maybe you want a big family because you are an only child, or you want just 2. But how many kids are in your ideal family? The third question is, realistically, how old will you be when you have baby number 1? And then realistically, how old will you be when you have your last child? And I think it's that last kid that women often forget about, because we're so focused on having our first baby that we don't think about, well, how old will I end up being when I have my last child? And the reason why that's important is, if you think about it, pregnancy is 10 months, 40 weeks, right? So it's basically a year. And then the medical recommendation is to wait 1 year from the birth of a child to the start of the next pregnancy. Again, the medical recommendation is to wait 1 year from the birth of a child to the start of the next pregnancy, and that's actually to prevent preterm labor and preterm delivery. So if you're waiting 1 year as minimum between children, and pregnancy is about a year, that's 2 years. So if you end up having your first child, let's say at 35, you're not going to be having your second child until 37. And if you aspire to have a third kid, you won't be you'll be about 39. And that's literally having your children back to back. And I'll tell you, as a mom, put my mom hat on for a moment. Most people want to wait longer than 12 months between intervals and children, because by the time your kid turns 1, you're barely kind of feeling back to your normal self. And so to turn around and have a child back quickly, it's hard for a lot of women. So we really want to be honest about how many kids we want and what does that mean for your timing, to then, if in the event that you do want to have 2 or 3 kids and you don't plan on starting till you're already in your mid-30s, then egg freezing would be a really good thing to consider, not for baby number 1, but for your last baby. All right, so how does egg freezing work? So we talked about it, I went over with you that each month your body recruits a set of eggs, and we talked about how that set of eggs needs to reach full maturity. And so the question I often get is it necessary to do injections, and why are hormones necessary for egg freezing? Is there a way to do this more naturally? And the answer to that is the only way that we can make these eggs reach full maturity is with the help of these hormones. But hopefully what will give you some peace of mind is these are hormones that our brain releases to our body every month already. So it's not something that your body's never been exposed to. It's the same hormones, just at a higher level. So it's not something that is going to be shocking to your system. And that's why the vast majority of women tolerate this process so well. And the most common symptoms are cramping and bloating, and not that you have to stay home for 2 weeks or any of that. And this whole process is only a 2-week process, okay? And again, just going over how we're being opportunistic, and it's the same hormones that are released by the brain. So it's really something that is really well tolerated and much quicker than most people realize. So you administer the hormones over a 10-day period, and we have really amazing videos that you can watch online, that you can watch from the comfort of your own home as many times as you want. So the picture here is one of our amazing physician assistants, Hina, who actually walks you through, from the comfort of your home, the injections and shows you exactly how to open the pen, how do you administer the injection. And the injections are teeny tiny needles that just go right under the fat of our skin. So you pinch the fat in your stomach, and the needle goes just under the skin. It's really very easy. And I know that the injections are a part that most women get very nervous about when it comes to IVF or egg freezing. And we feel really confident that once you go through our educational sessions, and we can actually do virtual appointments with you to better understand the hormone injections. And our team will even FaceTime you at night while you're giving your injections if you need that extra support. But it's 10 days of injections. And during that time, you'll come into our office about every 2 to 3 days so we can see how your eggs are responding. And once we see that the eggs have reached a point of full maturity is when we would extract the eggs. All right, so this is kind of a calendar format to kind of bring home the point I was making. So on the calendar, you can see that it has a little stop sign. So if you happen to be on birth control, that's when you would stop your birth control, and then you would start your injections a few days later. If you're not on birth control, then we would just start with your period, and you would start your injections 2 days after your period. And you're giving yourself injections for about 10 nights. And you're coming in about, like I said, every 2 to 3 days for blood work and ultrasound. Again, that's how we're monitoring the maturity or progression of your eggs. And then the egg retrieval would fall on one of the final days of the process, so that this process from beginning to end never takes more than 14 days. And that's often a misconception. People think egg freezing is like multiple months long or 6 months. I hear all these times, and it's really just 14 days. And we'll walk you through it and make sure that that timing works for your schedule. So if you have something coming up with work, or you have other considerations to take into mind as far as the timing, we can work with you to make sure those 14 days work for your schedule. All right, and the trigger shot is this last injection that you take about 36 hours before the eggs are retrieved, and that's what helps release the eggs from the ovaries, so that then when the doctor goes in, we can actually extract them from the body. And so the trigger shot is a shot that goes in your bottom, and we'll walk you through that as well. Again, we even FaceTime you to help make that easier for you through that process. And the actual egg retrieval, so now you've done about 10 days of injections, you've given yourself that final trigger shot. So now we're in the 12th to 14th day of the process, and we're going to retrieve the eggs. So the egg retrieval is done in an ambulatory surgery center in New York. It's in our office in Midtown, and each one of our team will tell you exactly where center you're at, depending on if you're on the East Coast or West Coast. And the retrieval is a 10 to 15 minute procedure. That's all, just 10 to 15 minutes. And it's done while you're asleep. So you have an IV sedation. So not full anesthesia like you're having major surgery, but almost like a twilight sleep. So you won't feel any pain. And during that 10 to 15 minutes, we put an ultrasound into the vagina and pass a very small needle while you're asleep that's guided by the ultrasound. And we go right up to the ovaries, so pretend this is your ovary, and we can suck out the eggs that we've been watching mature through a gentle suction. During this process, there's no cuts, there's no incisions, so it's all really done through microscopic little needle that's placed through the vagina. Really well tolerated. All right. And then during the procedure, this just kind of walks you through it, is just the very small needle, again, passed through the vagina, and we're extracting the eggs. Once the eggs are extracted, we give them to an embryologist, and they will then say, okay, we had 20 eggs, and of those 20 eggs, 18 of them are fully mature, and the fully mature eggs would then be frozen and saved, and any eggs that weren't fully mature would be discarded. All right. So I know it's been a lot already, but how many eggs should you freeze? And so as women think about how many eggs they freeze, it's really important to kind of answer those questions that I gave you for homework a few minutes ago. So how many kids do you want? And what's your timing like, right? And so we need about 10 eggs for an improved chance of one baby. And that's in a woman that's in her 20s to early 30s. So if you're in your 20s, early 30s, it's a 10 to 1 ratio. 10 eggs for an improved chance of one baby. And why is it 10 to 1 ratio? Well, of any 10 eggs, a couple of them just won't fertilize. A couple will fertilize but won't grow. A couple will fertilize even in a young woman and be genetically abnormal. And then hopefully we're left with 1 or maybe 2 genetically normal embryos. And so that's why it's a 10 to 1 ratio. So depending on how many kids you want to have and what your timing looks like will help you better understand kind of what your personal goal should be. Let's say you're 30-something and you want to have 2 kids, then our goal would be to freeze 20 eggs so that you have the best chances of having both of those children. All right. Another really common question that I get is, should I freeze eggs or embryos? And a lot of women will come with having done some Google research, and unfortunately Google can sometimes be our best friend and our worst enemy. But a lot of the literature, if you go in, that encourages you or makes you believe that embryo freezing is the only option is older information. So there was a period of time where scientists and our scientific community was not very good at thawing and freezing eggs. And during that time, this is about 10, 15 years ago, embryo freezing was the only option and really the only viable option because we weren't good at freezing and thawing eggs. Fast forward, egg freezing has really revolutionized this field because in 2012, the kind of the experimental label got lifted off of egg freezing. And since that time, we've had really amazing advances in technology that allow us to freeze and thaw eggs really well. And so now it's equal the playing field. So given a woman at the same age, so let's say a 30-year-old woman, whether she freezes eggs or embryos, the outcome is going to be the same. And by outcome, I mean how many children will she be able to have would be the same. Kind of the pro of embryo freezing is you get to learn more information today. So if someone freezes embryos, they'll know exactly how many embryos they have. You could even know what the gender of those embryos are. Whereas with egg freezing, you just know that it's a 10-to-1 ratio. So you have an idea that you're probably going to be good. Let's say you have 20 eggs and you want 2 kids. With embryo freezing, you just have more information. The other thing to keep in mind is once you fertilize an egg, you can't unfertilize it. And so not to be dismal, but let's be honest, we're amongst girlfriends here, that you may not be with that same partner. And so that's why I caution women when they think about freezing embryos is that what if you freeze embryos now and 5 years from now, you're no longer with that partner? And again, not to be a Debbie Downer, but it's just an important thing to keep in mind. So those are kind of the big things to consider. But the take-home message in this brief discussion is that we really do live in a time with advances in the laboratory where freezing eggs and embryos in someone who's in their 20s and 30s is really equivalent as far as the outcome. All right, so what comes next? Your eggs will be stored in a facility for as long as you want. So let's say, for example, here in New York, you freeze your eggs and you move. You froze your eggs in 2020 and now it's 2025 and you live on the West Coast, or you live in Paris, or you've moved to another city or state. We can always help you transport your eggs to wherever you live at the time. I obviously would not recommend that you move your eggs every time you move, but when you're ready to use your eggs, let's say you no longer live in that city or state, they can be easily transferred from one fertility center to another. So that's not something you need to overthink. And then my hope is that you freeze your eggs and you never need them. And I mean that honestly. I mean, I hope that you freeze your eggs and you're able to conceive naturally all the children that you desire. But in the event that, let's say you have your first kid, no problem, but your second kid, you're now older and you're having a hard time getting pregnant, those frozen eggs can significantly improve your chances of having that baby that you dream of. And so while it's not a guarantee, and I'll be the first to stress that with you, it can significantly improve your chances of having the children that you want. All right, and then what is IVF? So in vitro fertilization is what it stands for. It's the exact same process as egg freezing, except on the day where those mature eggs are extracted, we fertilize them with sperm. And that sperm could be your partner, your boyfriend, your husband, or it could be donor sperm. But that's really the only thing that differentiates egg freezing and IVF is a woman who wants to freeze her eggs does not wish to be pregnant today. She wants to be pregnant in the future. And a woman who does IVF desires to be pregnant today. So on the day that those eggs are extracted through this process we just went over, they're fertilized with sperm. And then 5 days later, we will see how many of those eggs became embryos. And then depending on your age and desire, we can genetically test the embryos to see if they're normal. And then we would transfer a genetically normal embryo back in your body to grow. And our rule as a society and also for the best interest of a woman is to transfer one genetically normal embryo into one uterus, because we know that singleton pregnancies, meaning a pregnancy with one embryo or one baby, has the best chance of being a successful live birth. So that's the major difference. The hormones are the same, the timing is the same, the procedure itself is the same. It's just when someone freezes eggs, they wish to be pregnant 5, 10, 15 years from now, and someone who does IVF wishes to be pregnant now. All right, so what does it mean to be infertile? As it is Fertility Awareness Week, we really want to kind of get some of our different definitions straight. Believe it or not, I sometimes will get a couple who literally just started trying, let's say in March, and they'll come to me in April and be like, oh my God, we're not pregnant yet. Is there something wrong with us? And the answer is typically no. But Infertility defined is the inability to get or stay pregnant after 1 year of trying if you're under the age of 35. And women over the age of 35, it's the inability to either get pregnant or stay pregnant after 6 months of trying, okay? So this is the part that I really want to revolutionize and change, is that most doctors don't want to talk to you about fertility until you've met one of these definitions, meaning, okay, you want to have a baby? Great, I'll see you in a year, I'll see you in 6 months, depending on how old you are. And what we want to change is we want to arm you with all the facts so that before you start trying, you know, all right, the sperm is good, my uterus is good, my ovaries are good, my egg count is good, I've done all my tests, I know I'm good, and you go into that year or 6 months with peace of mind, as opposed to waiting a full year to do any of your research. And then what is the reality of infertility is that 1 out of 8 couples will experience infertility. 1 out of 8, that's a lot. And that 1/3 of infertility cases are actually related to the man. And you know, while a lot of fertility is about the woman, a lot of getting pregnant and staying pregnant, you know, falls on us as women, we have to remember that 1/3 of fertility issues are actually related to men. And that's why that semen analysis becomes so important. And we can do semen analysis for your partner if you have one at Kindbody. All right, so what are your options? Again, as I mentioned before, the most important thing to understand with fertility is that one size does not fit all, and that we are going to tailor your treatment options based on what you need, and also what you or if you're a couple, what you guys want and what you're comfortable with. Because we often will meet couples who aren't quite ready for that IVF journey, and if you're a good candidate, and we'll be honest with you, and some of the less invasive treatments are an option, we'll definitely explore that with you. And then we also want to go over other options, you know, sperm donors. If you are a woman who wants to have a baby on your own by choice, or you're a same-sex female couple, so sperm donors, and we can help you through that process. Or you are a woman that's reached an age, or you've had surgery, or there's a reason why you don't have eggs of your own, going through egg donors is an option to conceive and have a baby and expand your family. And then also gestational carriers. Again, it may be that you have a medical condition or you've had some type of surgery that prevents you from being able to carry a pregnancy yourself, or you're a same-sex male couple that needs a carrier. It's all about family building. It's all about helping women and our patients achieve, you know, kind of the family of their dreams, and we definitely will help you explore all of those options. So what are your next steps? Whether you are actively trying to get pregnant, maybe you've already had fertility treatments, maybe you've had some miscarriages, or maybe you just are thinking you'd like to have a baby someday and you have no idea when that someday will be. My take-home message is again, it's never too early or late to learn more about your body and to just get some objective facts, so that then it can help you kind of decide what your timing is like more objectively than kind of just crossing your fingers and hoping for the best. All right, so let's talk about cost. You know, we are really big at Kindbody about transparency. And so the first thing that I really encourage everyone to do, again, regardless of where you are on your journey, is to do an assessment. And again, we're so cognizant of what's going on with this pandemic right now. So virtual assessment, you don't even have to leave your couch. So the virtual assessment, we accept insurance for all of them. So the maximum you would have to pay if you have a really high copay or high deductible, or maybe you don't have insurance, would be $75. For most people, if you have insurance, you're just paying your copay. So it would be significantly less than that. And then for those of you who are attending today's discussion, you'll get a special code that we'll send to you after the event called, and that code will provide you to get $1,000 off a cycle of egg freezing, which would bring the cost to $5,500, and choose that $1,000 off of in vitro fertilization or IVF, depending on what you need. So just by attending this talk, you'll get $1,000 off either egg freezing or IVF. And we're not asking you to make any commitments right now. My only dream for you right now is to just learn more about your body, but we just want you to know that if you see us and then subsequently decide to proceed with some sort of treatment, that we will honor those discounts. And then we do accept all insurances I just mentioned. A lot of them are listed here. So Aetna, Anthem, Cigna, Blue Cross Blue Shield. You can use your FSA accounts and your HSA. We know it's the beginning of the year, so most people have some money in those accounts. So you can use those to pay either for towards your deductible or towards the cost of any treatment. And again, we'll break it up with whatever you're comfortable. If you're comfortable to come to the office, we can do your full assessment here. If you want to start off with the virtual, we can do that for you. And remember that you're getting some pretty significant discounts, which hopefully will be helpful. And that's the end of this talk. I hope that it was helpful, and I'd like to open it up for questions. And I'm also going to ask, I have my colleagues, Dr. Nicole Brown and Dr. Serena Chen, both Serena Dovey, both here, and can help me answer any of the questions as well. So I'll hand it over to Rebecca, who will be the moderator of our questions.
Amazing. Thank you so much, Dr. Sasan. So we got tons of great questions in the chat privately. So I tried to put as many of them forward as possible, and we're going to answer a bunch of them here. I think we've weeded out all of the disruptors in the chat. So the chat's actually back on. So you can now use the chat again, and apologies for that. And thank you for your patience. So let's get to some questions. Okay. We have a lot of questions about fertility and age. So what age is the right time to come in for an assessment? What age is too late to get pregnant? Can you just speak more to fertility and age generally?
Yeah, so we do know that fertility declines with age, and as I mentioned at the beginning of the talk, we're born with all the eggs we'll ever have, and our egg count declines as we get older. But I also mentioned that 1 out of 10 women will have premature decline in their egg counts prior to the age of 35. And so there's some general rules that we expect the majority of women to have good fertility up, in their 20s and 30s. But, and I'm sure my physician colleagues here will agree that we sometimes meet, unfortunately, 20-something-year-olds who have poor fertility. And so the most important answer to that question is, regardless of how old or young you are, to come in and do that assessment, because we could sit here and be hypothetical and give you generalized answers all day long, but the key is every woman is unique. And so regardless of how old you are and what your plans are, again, maybe you want a kid 10 years from now, it never hurts to learn some objective facts about your fertility now. And then as far as what's the maximum age, in the United States, our governing body for fertility care is the American Society for Reproductive Medicine, and the maximum age where we will utilize fertility care to help a woman conceive is 55. So again, everyone may have their own opinions on that age, but just to give you an idea, it's quite older than many people think.
Can you talk a bit about what it means to have an inconsistent cycle, if that could have a negative impact on fertility, and any recommendations when trying to get pregnant with an inconsistent cycle?
Sure. A lot of women don't have clockwork cycles. There are some women who get their period every 28 days and literally set a watch to it. But the truth is that for many women, their cycles are irregular. So maybe sometimes it's 28 days, sometimes it's 60 days. Or women who have polycystic ovarian syndrome, which is called PCOS, may get 1 period a year, depending on how severe their PCOS is. And so these are all things that we can kind of help you, walk you through. The best answer to this is that there's no general rule of thumb, but by better understanding what your fertility goals are, but if you want to be pregnant now or you want to be pregnant in the future, that would help me answer the question specifically for you better. But if you come in and we can do an assessment and look at your ovaries and get an idea, do you actually have PCOS? Do you not have PCOS? Are you not getting your periods because you have a really low body mass index? Is there some other medical condition that's preventing you from getting your periods? Or is it just that you're a little irregular? We can really help give you a personalized plan of how to conceive. And it also is important when you want to get pregnant.
Thank you. We have some questions about unexplained infertility. a woman shared that her and her husband went to the doctor and there was nothing wrong with them, but it's been over a year. What do you recommend in that case?
Yeah, Dr. Brown, do you want to take that?
Sure. I sometimes feel as though unexplained infertility is the hardest diagnosis to give a couple because all of the testing comes back just fine. And when I talk about testing, it's testing to determine the male partner's fertility, a semen analysis, looking to find out if the fallopian tubes are open, if there's anything inside of the uterus that can compete with the baby for space, like a polyp or a fibroid, and even ovarian reserve for the female partner. But that specific couple who has been trying for over a year to conceive, who have been given the diagnosis of unexplained infertility, I would encourage them to come in to see us, to sit down and talk with us about possible treatment options. Sometimes unexplained infertility, it's just because we haven't done all of the testing yet, okay, to try to figure out if there is truly an issue that could explain their infertility.
Thank you. We also have some questions specifically about IVF. Dr. Brown, if you could take these as well. Is IVF more successful with fresh or frozen eggs?
Okay, so good question. I think it goes back to what Dr. Sasan had shared with us all today. It comes down to the age of the female partner and if there's any underlying causes for infertility with the male partner or any issues with if there are any other infertility diagnoses. Fresh or frozen, pregnancy rates are exactly the same. And so if it's a timing issue, and if you're not looking to get pregnant right away, I say freeze your eggs. The only benefit of using fresh eggs is if you're thinking about creating embryos, but creating embryos it just gets you out further into the process. But there's no difference in pregnancy rates whether you use frozen or fresh eggs.
Thank you. Dr. Sasan, we have some questions about whether you can get these initial tests at a regular OBGYN or if you need to come to a clinic like Kindbody for them.
Yeah, so the blood test, obviously, you could do anywhere. My wish was that everybody would have it as part of an annual checkup, but unfortunately, our society hasn't quite caught up with that yet. But the part that is distinctly different is the ultrasound. And so we'll get a lot of patients who are like, oh, I had an ultrasound because I thought I had a cyst. I had an ultrasound in an urgent care center, in my doctor's office, or in an emergency room. So I've already had an ultrasound, so I don't need that. The key thing to understand is the ultrasound we're doing is doing a follicle count. And the follicle count is actually counting the premature eggs that your body recruited in a given month. And that's not done in a normal gynecologic office or as part of like a regular radiology pelvic ultrasound. So just because you've had a pelvic ultrasound doesn't mean you've had a follicle count. And that follicle count is uniquely done in a place like Kindbody or in a fertility center. And so that's where that becomes helpful. And the other part that I think becomes helpful too is that by coming to see us at Kindbody is that we can really help explore your options, because just having the results sometimes can be confusing if someone isn't there to kind of really help you walk through what they actually mean. With that said, if you've had the testing done previously, bring us what you've had done. We'll never make you repeat something just because. So if you've had an ultrasound done and someone actually did a follicle count, or you've had your AMH level tested and it's still valid, so it's within the last 6 months, depending on your age, we won't need to repeat it. So we're happy to look through records you have from any other doctor or fertility center as well.
Thanks. And along the lines of the consultation, we have some questions about the virtual consultation and the in-clinic one. Can you talk about the difference and if there's anything people should do in advance of the consultation or assessment?
Yeah, so the virtual component, so in any appointment, there's the talking portion and really going over your history and your desires and the options and the counseling portion. And then there's the actual action portion, which is doing an ultrasound and doing blood work. So if you come to our clinic live, then obviously we can do the counseling portion, the talking portion, as well as the ultrasound and blood work on the same day during the same visit. And that's usually about an hour-long visit. But let's say because of the pandemic or just because of your timing or your schedule, you'd prefer to do the counseling portion of it virtually, we definitely can do that. And then we would coordinate or schedule for you to come in for the in-person portion, which is the ultrasound and blood work at a later date. And what can be helpful, especially during the pandemic, is it'll reduce the amount of time you're actually in the office, because the counseling part tends to take the longest time. And so if we can do that in advance, then when you come in for your blood work and ultrasound, that's a quicker visit. But we're here and we're being extremely flexible. So whatever works for you is going to work for us, but that's what the two contain.
Thank you. We have a lot of questions about reciprocal IVF. So if there are two women who are going through IVF together and you're going through the process together, can you speak more to that, maybe Dr. Brown?
Sure. Well, I would start with the female partner who's the youngest, because again, it's always going to come down to the quality of our eggs, and our age dictates quality. And so I would encourage the female partner who is youngest to undergo stimulation first, and have us create embryos using that partner's eggs. And then it would be up to the couple as to whom would carry the pregnancy, and we can facilitate that too. Age doesn't really have an effect on the uterus, not until the age of 50, where we can start to see changes to blood flow. So we're not overly concerned about age on the uterus and the ability to carry a pregnancy until somewhere in our 50s. So I would say age really here comes down to the quality of the egg. So I would start with the youngest female partner.
Great, thank you. We have some questions about genetic testing. Dr. Brown, can you speak to genetic testing, PGT, what that is, how much it costs, what we should know?
Sure. Okay. So if you go through IVF, you have the benefit of testing your embryos early to determine whether they carry a chromosomal abnormality. And these aren't single gene defects. This is chromosome numbers. Okay, so we're all born with a set of chromosomes, and if we're missing a chromosome or if we have an extra chromosome, it can result in a genetically abnormal embryo that potentially will not result in a pregnancy. But there are some chromosomal abnormalities that can result in a live birth and potentially or early loss. So if you go through IVF, to create embryos, you have the benefit of doing genetic testing, not only to determine chromosome numbers, but you can also know the gender of your embryos. Now, there is also genetic testing if you carry a single gene disorder. Again, you have the benefit of having your embryos be tested if you and your partner are a carrier for a single gene disorder, to make sure that you won't have an affected embryo before undergoing an embryo transfer.
Thank you. Maybe Dr. Sasan, can you speak to a bit more about anything that people can do to potentially improve fertility, health, diet?
Absolutely. Well, first and foremost, I encourage every woman, whether you are actively trying to conceive or thinking about starting that journey as early as this summer, or you don't want kids for another 10 years, to really be the healthiest version of yourself. I can't stress enough how important it is to take care of your body, to take care of your mental health, to not smoke cigarettes. Smoking cigarettes is the one factor that has been shown to harm male and female fertility. I know, so vitally important to stop smoking cigarettes. But in addition, to recognize that being underweight is just as bad as being overweight, and so to really be cognizant of that. And then I can't urge women enough to really seek mental health and therapy if that's something that's affecting you, because our stress levels and our emotional health are so vitally important for our bodies, for our general health, as well as for our fertility and for our ability to maintain pregnancy. And so and that's why within our Kindbody system, we have nutritionists and therapists that are readily available to you through virtual consultations as early as today, because you can't just compartmentalize, your pelvis and have a baby. So it's so important to utilize all of those. In anticipation of a fertility assessment, come as you are. There's nothing you need to do in advance. So if you're on birth control, come as you are. If you have an IUD, it doesn't need to be removed. Again, it does not need to be removed. You don't have to do a cleanse before you come see us. Just come as you are. We're going to help walk you through what you need based on what your goals are. And also don't overthink, like, when is my period, or I haven't had a period. You really just come as you are today. Let's start off with the virtual counseling part and walk you through the rest of it as well. But there's really no preparation you need to do. Just be the healthiest version of yourself, and that's just good for all of us to remind ourselves.
Thank you. Dr. Brown, we have a number of questions about PCOS, hyperthyroidism, fibroids. Can you speak a bit to that?
Sure. Well, PCOS is actually a hormonal disorder that can affect our ability to conceive until we sort of correct the hormonal environment around our eggs. Women with PCOS actually are making more testosterone than other women, and that extra testosterone production can actually affect the quality of our eggs. Most women with PCOS, they tend to have very irregular menstrual cycles. And until we find ways, and we do have those ways, to correct that underlying hormonal imbalance and regulate their cycles, they may have a harder time at getting pregnant. But the most important thing to remember with PCOS is that women with PCOS have about a 30 to 40% chance of miscarrying. And so it's really of utmost importance to correct that underlying hormonal imbalance to try to also reduce their miscarriage rate. The other one, I believe, Rebecca, you said was hypothyroidism? Sure. Okay, so we always check a baseline TSH level when you're trying to get pregnant, because if we find out that you have true disease, hypothyroidism, it can actually make it very hard for you to conceive. It can actually even prevent you from ovulating, and you have to ovulate in order to conceive. There is an association with even subclinical hypothyroidism and the potential risk for miscarriages. So I always encourage women who are either thinking about freezing their eggs or going through IVF or other options to conceive to be euthyroid before they get pregnant. Rebecca, I believe the last one was on endometriosis. So endometriosis is a diagnosis that can cause infertility for some women. Not all women who have endometriosis are infertile, but we believe that it's due to an underlying immunologic disorder where endometriotic implants are releasing I would consider it even toxic factors or growth factors that can affect their ability to hold on to a pregnancy. You can even get disease of endometriosis within the ovaries that can affect egg count. And so there are ways to treat endometriosis to help a couple be successful on their journey to starting their family.
Thank you. And then Dr. Sasan, we talked a bit about health. We had another question specifically about smoking. Can you speak to the effect that smoking might have on fertility?
Yeah, so we have, unfortunately, cigarettes have been around for a long time. And so we have a lot of epidemiological data to show that, that smoking cigarettes can reduce egg count in women. And we also have good data to show that smoking cigarettes can actually harm sperm as well. And so those are both kind of well-substantiated data. Now, I don't want anyone to think because you were a smoker that you don't have options. Again, the key is to come in and do the assessment and let's learn more. But it's unfortunately a habit that we know can harm so many aspects of our body, from the texture of your skin to lungs, our bladder, skin cancer. There's so many risks to smoking, but an additional one is fertility. And so, but I also don't want someone out there to panic if you are a smoker. It doesn't mean you can't have children. There's no better time than the present to start smoking, and we can even direct you to ways, smoking cessation methods that can be helpful. The bottom line is we know that it's unhealthy for you, and this is one other reason of the plethora of reasons to hopefully encourage you to stop.
Thank you. We have some questions about whether it's safe to proceed with egg freezing now in the current situation and what you would recommend for someone considering proceeding with it right now.
Absolutely. And so the biggest factors with coronavirus and with the COVID-19 pandemic has been that it's contagious, and that we've proven societally that social distancing has helped reduce the transmission, and in many cities and states, I know, I'm happy to say here in New York, which was really hard hit, that we've now reached our peak and are kind of on our downward slope. But as far as like actually affecting our eggs or affecting a pregnancy, there's been no research to show that COVID-19 or coronavirus actually harms one's fertility or in any way actually impacts a pregnancy. Unlike, like Zika virus, for example, it's not been shown to cause birth defects or anything like that. And so things that we really kind of pride ourselves in, in our New York office, which again, we've been open throughout the pandemic, but we're expanding our services as of last week, is we're really taking extra precautions. So our clinics, and that's true across the country, are solo standing, meaning you're not coming into like a multifactorial doctor's office. It's just us, and we're taking extreme caution. So we have all of our patients wear gloves, all of our providers wear gloves, everyone in our clinics are wearing masks. We reduce the time that you're in the office by putting you straight into the room and making sure that your entire visit occurs in the same room. We're also doing virtual appointments to help kind of reduce the timing that you're here in the office. And then all of our centers too, where the actual egg retrievals occur, are designated solely for fertility patients. So it's not like you're walking into a big hospital where you might be exposed to sick people. And we really do take all of that really seriously. So your health and the health of our healthcare team is a paramount importance to us. And so I really do think if you are ready to proceed, that this is a great time. And actually, to be honest, some of our patients are preferring to start now because they are working remotely. They do tend to have a little bit more time on their hands than their normal life schedule provides. Maybe you're not traveling as much because of the travel bans and things like that. So it could actually be an opportune time for many women, and we do take your safety, of utmost importance.
Thank you. And can you speak a bit about the difference between using Kindbody and another fertility clinic that might have a hospital name associated with it? How does Kindbody differ from those other options?
So at Kindbody, one of our biggest differentiators is that we actually provide a really comprehensive suite of services, unlike your typical, fertility practice. So we do the entire spectrum of fertility care, but we also have as an adjunct to the whole array of GYN services. So I do think that the idea that you get your entire comprehensive women's health care under the same roof, that we have OBGYNs working with fertility doctors in the same place, is really beneficial for us as women. I also think that our nursing care and our support staff is really second to none. I've heard from so many people. I mean, here in New York, really, fertility clinics are like Starbucks. There's one on almost every corner. And one of the feedback that we often get from our patients is the experience is truly different at Kindbody. And we really pride ourselves in that individualized care, that individualized attention, that you're not just another number going through this process, but that you are your own woman and you have your own aspirations and your own timing, and just being really respectful of the individual, to spending time with you to make this to be a partner in this through your journey, and to be respectful of your time and to be respectful of your needs, especially through this pandemic. And so I think that's what really differentiates us. And the other thing that really sets us apart is the price. Our pricing is 30 to 40% less than most centers. And I want to stress that while we may be a newer company, there's nothing new about us. So we have collectively been doing this for at least 15 to to 25 years each. We all are experts in this field. Our chief medical officer, Dr. Lynn Westfall, was actually one of the first doctors to freeze eggs in the United States through the Stanford program. So we really come together as a team of experts, both on the clinical side as well as in the lab side. Our lab team has at least 25 years of experience. Our lab director has been doing this for almost 40 years. So we really have a tremendously skilled group of people who came together as a group of women wanting to provide the care that we as women wish we would receive ourselves. And I think that's what really sets us apart.
Thank you. So we'll just do a couple more questions. The chat's open now, so if there's anything pressing that you haven't asked, ask it now. We do have some more questions about pricing and insurance. Can you just speak to what is and what isn't covered by insurance and how we sometimes work with employers to help further reduce the cost?
So obviously, I'll start off by saying that insurance varies. You could have, everybody in this chat could have Blue Cross Blue Shield, and your plans might be different within that umbrella of Blue Cross Blue Shield, for example. So we have the team to kind of help you understand your benefits, to help you understand kind of what's covered and what isn't covered. So that can be a whole mess by itself. And I use the word mess intentionally because it can be very confusing. But here's some basic things. So if you are freezing eggs or freezing embryos, that is considered elective. So you are electively choosing to prolong your fertility. And there are no basic insurances, meaning no insurance that you just commercially buy, like Blue Cross Blue Shield, Aetna, Cigna, fill in the blank, that would cover that. However, you may have an employer, meaning your company covers that as a benefit. And so we actually have helped a lot of our patients kind of champion that cause through their employer. So we actually even have a designated team, if that's something you're interested in bringing to your company, that can help you kind of expand those services through your company. IVF is a different story, or let's say you actually have an infertility diagnosis, then a lot of insurances or some insurances may cover that, because once you have an actual infertility diagnosis, then the insurance coverage is different. And many people may have insurance coverage for infertility treatment, whether that's an intrauterine insemination or IVF. And again, we can help you understand that better on a case-by-case basis, depending on your insurance.
Amazing. Thank you. So we're going to wrap up in a minute. Just wanted to let everyone know that we're having events throughout the entire week. We have a emotional support event tonight. We'll be kind of talking to fertility therapists about ways to cope with fertility issues and just generally. The full schedule you can find on our Instagram and on the Eventbrite with all the events. We also have on Wednesday a cycle prep event. So if anyone is considering moving forward with an egg freezing or IVF cycle, we're going to get into all the details of what you do, where you get your meds, how you prepare. So recommend joining that event on Wednesday. And we're going to be sending an email out to everybody with the slides and the video, as well as that special code we provided that you can use for a discount on your assessment and your cycle. And thank you all for joining us. I'll hand it back to the doctors to say their final words as well.
I hope you guys found this informative. We hope that you join us for some of the other events that we have this week. And I think my take-home take-home message for you guys as the founding physician of Kindbody is that, this might be fertility week, but we think it should be fertility year, and that we should focus on our fertility 365 days a year, and that we as women really need to be proactive. And so I really encourage all of you, regardless of where you are in your journey, to at least sign up for that virtual consultation. It's likely going to be covered by your insurance, so you may have a $25 copay for most people to do it, and just gives you an opportunity to learn more. And then what you decide to do with it then is your choice, no strings attached, but I think it's a really good starting place, again, regardless of where you are in your personal journey. And I hope you guys are all healthy and safe, and I hope that we can do this in person again very soon.
Thank you so much. And we are just leaving in the chat here. We tried to answer as many questions as possible. There are so many amazing questions. If anything didn't get answered, you can always email us, navigator@kindbody.com. You can always schedule a virtual consultation, you can do that on our website, and that's a conversation that's really catered to you, so we can dive into all of your specific questions and set a plan that's really catered to you. Or you can come to one of the other events this week, and we promise you in some way, at some point, we will get all of your questions answered. And thank you so much for joining us.